Planning on getting a hair transplant? Here's what you need to know. If you are considering hair transplant surgery, there are some important points to note down. Some people think hair transplants are just for men with bald spots on the back of their heads. But women also suffer hair loss and can benefit from hair transplant surgery as well. You will want to plan ahead before scheduling your hair restoration procedure. Here's what you need to know before planning on growing a hair transplant. To stay up to date with latest top stories, make sure to subscribe to this YouTube channel by clicking the button above this video. What takes place during and after the procedure? Hair transplantation surgery is usually performed by hair restoration experts who are also doctors. This hair transplantation surgery usually takes up to 8 hours. During the procedure, you will be under the effects of anesthesia, so there will be no pain or discomfort. There are also hair replacement systems that are sure to help you grow hair on a once barren scalp. As it turns out, hair transplants are not that scary or painful. After the hair restoration process, most patients experience swelling and bruising, which can last for about 3 days. Since hair grows in stages, hair growth after the procedure is not seen until 3 to 6 months later. Hair replacement techniques are minimally invasive, fast, and effective for hair loss sufferers, making them a go-to when it comes to dealing with hair loss. What is a hair transplant? Hair transplant surgery is a medical procedure to restore hair. The surgery takes place in 5 stages, which are preservation implantation, graft extraction, post-op care, preservation, and pre-op consultation. Each one consists of several steps and lasting between 5 and 8 hours, on average. Hair transplant is a hair restoration technique that can be used on all types of hair. It is used to cover bald or hair loss areas. This hair restoration method is permanent and can be performed on any area of the scalp, including the hairline. It's a safe procedure because it uses existing hair from other areas of the scalp to cover bald areas. Types of hair transplants. There are so many types of hair transplants. These might include follicular unit transplantation, FUT. FUT is done by removing a strip of hair from the back or side of your scalp, which contains 1 to several hairs that are then divided into as many as possible grafts with healthy hair follicles. Scalp reduction surgery is a hair restoration procedure done by removing a strip of hair from the back or side of your scalp and then carefully refashioning it into a smaller area. Usually, hairless areas are removed in between hairs to allow for more hair growth later on. Then grafts are placed within these newly created hairless areas. Follicular unit extraction, FU, is a hair restoration procedure done by removing hair follicles one at a time in their naturally occurring groupings. The strip is then closed with sutures and no visible scarring will result. The cost of a hair transplant. The cost will vary based on where you get it done. There are various hair transplant clinics to choose from, but do your research and be sure that they have a good reputation by checking out reviews online or asking friends for recommendations. The cost of hair transplants can vary depending on how much hair you need to be transplanted. It's best if you plan ahead so that your finances don't become a problem. Choose the hair restoration specialist that offers better services even on a tight budget. How to prevent further hair loss. Your hair loss will not stop after hair transplant surgery. However, you can take a few steps to prevent your hair loss from getting worse. Try to avoid situations that may lead to further stress on the body, such as excessive exercise or poor nutrition. Furthermore, hair transplant surgery is no longer as expensive because it is becoming a common practice. Things you should know about the procedure beforehand. Hair transplant procedures are usually scheduled weeks in advance because it's a surgical procedure and requires time to recuperate after surgery. It is also important to get enough rest post-hair loss treatment, so plan ahead. If there comes a point where you cannot schedule hair transplant surgery as hair loss progresses, then you'll have to look into hair restoration treatments that do not require surgical procedures. Hair transplants are a great option for people who have experienced hair loss due to medical conditions, such as cancer treatments. For those looking for an affordable and low-risk solution to their balding problem, then the above pointers will greatly help you if you are planning on getting a hair transplant. A dad of 3 kids and is a keen writer covering a range of topics such as internet marketing, SEO and more. When not writing, he's found behind a drum kit.